So anyways, just so everybody's on the same page here, microplastics is any plastic particle that is less than 5 millimeters. So some of it are really small, but you can see with your naked eye. But some of it literally is, it also includes nanoplastics. So tiny plastics that we can't see, which is most of what I think Q and I are discussing. It's probably more of the nanoplastics. But essentially microplastics encompass all of those things.
And to give them a visual, nanoplastics, to describe how invisible they are to the eye, take a grain of sand and then imagine 1,000 times smaller than that. That's about how tiny these microplastics are. Here's some interesting places that they've found them. Blood clots. 80% of surgical removed blood clots contain microplastics. Breast milk. This is interesting. I would love for you to go deep on here. Breast milk. 76% of samples from lactating women contain microplastics.
And even the placenta is the one. And so that's kind of what, what I was thinking of it with was like regarding health, right? Like, sure, these microplastics, but what is their significance? And I think while we found them in a lot of places, like they're found in the cardiovascular system, and we've linked it to cardiovascular disease, and also in like the gut microbiome, we've done animal studies. There's animal studies out there, and you can see the harm. But when it comes to human studies to actually make these bigger claims, you're talking about the ethics of it, because you can't expose a control group to microplastics and follow them over time. So really, now that we are aware of microplastics, we're essentially gathering data from society, as we pass away, but it's not in a control. There's no control group. There's nothing controlling it. So it's very hard to determine, like, okay, this person died of cardiovascular disease. How much of that was due to microplastics compared to, other things? Because as I say, it's unethical to use humans to actually conduct the study. So literature is a little limited on that right now in regards to that. But I think, we can definitely tell that while we may not be able to say the magnitude, we can definitely say it's multifactorial, but it contributes hugely. It was found, so you get it via, the most common ways are ingestion and inhalation. So things that we eat, and even in our air, there's microplastics. And so what I was really interested in is, over the years, if you look at colorectal cancer, even just 20, 30 years ago, the prevalence of colorectal cancer was less than it is now. Like every year, people are getting diagnosed with cancer more and more. And while have our screening methods improved? So are we detecting more because of our screening methods? Maybe, but that doesn't account. I really think that cancer is increasing in the population. And while I'm not going to say, 100% of cancer is due to microplastics, I definitely think that it plays a role in the development of cancer. Can we prove that? Not at this time. But, it's been shown to, like, how the body gets rid of toxins, and how the body, how the liver gets rid of toxins. It's basically your antioxidizing organ, Microplastics are built up in that organ, and then how well does it function to get rid of things that could, cause cancer? Or if you have, plastic in your gut, like how much of that is contributing to cancer? I mean, screening for colorectal cancer used to be 50, and within the last several years, we actually moved it down to 45, just since.